Our first guest today is Dr. Ted Parcel of Novant Health Orthopedics and Sports Medicine, Brunswick. Welcome, Dr. Parcel.
Thanks again for having me, June.
I know you've been here recently. We seem to have you a lot lately.
We've done it a few times, but I'm happy to be back.
Well, that's good. I'm glad to hear that. I want to jump right into your practice. So tell me about your focus areas. What is it that you focus on primarily?
Sure. Our practice is, of course, orthopedics and sports medicine, but my specialty more specifically is related to hip and knee replacement. From the simple routine total knee replacement to the complex redos and revisions, we take care of any and all of them here within our practice.
Tell me about the most common conditions you see when a patient comes for their initial visit. What's their most common complaint?
Sure, we probably see more knee pain than hip pain.
Really?
Yes, and by and large, most guys have a breakdown, probably about 2/3 knees, 1/3 hips, somewhere in there.
I thought it would be hips.
It's actually knees that are more common.
Really?
Yeah, and you see the numbers across the country. More total knees are done every year versus the number of total hips that are. But a lot of arthritic joint pain will start out. Some patients have had surgery before. Some patients are brand new and this is the first time having pain, and we can start from scratch or we can pick up from where someone else may have left off. We've done it all.
So you can focus on hip and knee surgery. So what causes hips and or knees to give out?
There are various reasons. Hips to start.
It's not just getting old?
That's an easy way to put it. But the top two ways that we see hips fail are, one, there's a low degree of dysplasia where the hip was not shaped properly at birth. You know, we catch some of the real outliers as newborns, but some of the real subtleties we don't catch, and they show up later in patients' 50s, 60s, 70s, and they show up with some hip arthritis after many years of having that. And the other entity is more of hip impingement that we've started to have a better grasp of in the last 15, 20 years. And that tends to start more in patients' teen years and 20s that we can sometimes catch them. But if left untreated, which happens most of the time, they can go on to have an arthritis down the road, and again, their 50s and 60s. And then as far as knees go, knees tend to be a bit more post-traumatic. You'll see old injuries, former meniscal tears that were done many years ago, and after years have gone by, they've gone on to have arthritis.
Yeah. Do athletics play a part in sometimes of those knees?
They can to a certain degree, but I've seen them in sedentary couch potato patients too that are not they weren't playing college athletics, that didn't have an injury there. But it can be, sometimes it's just the way, the cards you were dealt that you end up with arthritis than it being some defined sports injury that years down the road led to arthritis.
Yeah. I'm curious, what's the recovery time for orthopedic surgery? Start with hips. What's the general recovery time?
A lot of times we're doing some of these patients as outpatients. We're
That's
sending them home the
heard.
same day.
That's what I heard.
If patients are safe, I'm getting more and more into it, and it's become more of a trend nationwide of sending people home the same day. I mean, patients are happier to go home and sleep in their own bed, eat their own food, sleep in their own clothes, and happy to be at home. Hip recovery is faster than knee recovery. There's less pain and less real defined rehab needed. But I've had hip patients come into their first post-op visit not carrying a cane or anything like that, walk in, walk out like nothing ever happened. Knees are a little bit more involved. There's more rehab.
I was going to say there's a lot of rehab after that, isn't there?
Most certainly, yeah, for several weeks thereafter, depending on the patient's progress. But it can be several weeks after surgery.
Do they necessarily have to have home physical therapy, or
it depends on the person? I tend to stay away from a cookie cutter that every patient's got to have this. You have to tailor your approach. Some patients, we've taken care of widows and divorcees that are on their own, or they have some help from a friend or family member for a day or two. We'll get home therapy to see those folks. And some of our outpatient, total joint replacements that went home that same day benefit from home therapy for at least a few days, just kind of get the ball rolling until they're ready to go to outpatient therapy.
Yeah. Let's talk about new patients. When they come in, do you automatically think surgery, or are there other steps you take prior to the?
No, there's kind of, I tend to try to start, go from beginning to end and try to present all patients. I'm not one of these surgeons who tries to strong arm a patient. Darn it, you got a bad knee, you need surgery, let's go. I've seen knees with awful x-rays that I've injected periodically for years and years, and they do fine without surgery. Some others are not the case, but surgery is not the first option for nearly everybody, I believe.
Yeah. What is, talk more about the role PT plays in after surgery.
Yeah, I use PT a lot post-op to get people back to what they want to do. Therapy can help patients make that transition from a walker to a cane and then nothing. Help set up their home exercise program, help get patients back to their recreational activities. And around here, we see a lot of golf and pickleball and swimming and those sorts of things. Get patients back to doing what they want to do.
You find that a lot of your patients have ignored their pain for quite a while before they show up?
We did. We've seen, over the events of the last
I'm sure it's a mixture, but
the events of the last couple of years, quite a few folks have stayed at home and they've not gone out to seek care, and we've seen that. It's very varied. You've had patients who've had just a week or two of pain, and there are some patients that have had pain for 10, 20 years.
Yeah. I know my husband complained about his knees for 3, 4, 5 years before he had a knee replacement. So.
And some people just tough it out. I've seen some of those patients come in, they've been toughing it out for 10 years. You see the x-ray, you're like, oh my, that there's severe disease. But hey, if they can tough it out, all the better.
Yeah. What range of age do you see in your office? Do you see children or?
We'll do some children's fractures and such.
Okay.
But they tend to be outside my group of my joint replacement patients, of course.
Yeah, that's true.
My joint replacement patients, I've done some dysplastic hips in patients in their 20s and 30s that have had to get done.
Really?
Knees tend to drift a little longer, but we can see, most adults and evaluate them.
I've heard people say, oh, I don't want to get it when I'm too young because then it'll wear out and I'll have to have it redone.
And that's the old fallacy.
I thought it was probably a wise
In the early 2000s, we treated our implants and sterilized them a little differently, and it made them more wear resistant.
Okay.
So especially on the hip side, those implants would wear out eventually, but now with the newer implants, they're not wearing as often, or as quickly, I'm sorry. And they're wearing more slowly, and it allows us, this is going to last longer. We can jump in sooner instead of trying to wait and let patients kind of sit around uncomfortable for a while.
Years ago, I've heard patients say, well, they recommend I wait a few years because but this was years ago.
It's different, if you have somebody who's 40, it may behoove you to wait some time, but if it's patients, 50, 60, 70, just do it.
Yeah, it'll probably outlast them.
It quite often will,
You mentioned redos.
Yes.
So you're comfortable if a patient moves down here and they've had a prior replacement?
We've seen quite a lot of that lately.
Really?
A lot of patients over the past year or so have moved here, particularly from the Northeast.
Yes.
And I've seen many joint replacements done through, Pennsylvania, New Jersey, New York, Ohio, Maryland, all over, and have come down, hey, I haven't had it looked at in a few years, let me look at it. Many of which are fine. Once in a while, you see one that may require some additional work.
Well, that's great information. You've been a great guest today, and I so appreciate you coming on. And we want to have you back soon because I hear there's a lot of things happening in the orthopedic world in terms of equipment and what have you.
Certainly.
So looking forward to having you back.
We'll be back.
All right. Thanks again.